Assalamu alaikum. Welcome to our exciting grand show, the paper presentation program, episode 9. Hopefully, we all are well by the grace of Almighty, even in this COVID-19 situation. So the pace of our studies hasn't stopped by the help of Axis Dental School during this COVID-19 situation. Axis Dental School has organized many type of amazing educational and non-educational competition previously. So as well as today's gorgeous show are also arranged by Axis. So the main gear of it is journey towards excellence. Many people like our honorable teachers, ambassadors, coordinators, mentors, exist workshop event team members, and so many people are giving effort to make the best quality of this group. I just want to be thankful to our honorable president, Dr. Farhadul Islam Bhaiya, for presenting a glorious event like this. And those for whose contribution we can learn so much is our esteemed teachers from our own country and abroad. Actually, for them, we feel more progressive in this BDS curriculum. So we are very thankful to exist from the bottom of our hearts for the highest destination, for give us the doorstep of our highest destination and give us such a wonderful company. Tonight, I am feeling very glad to get the opportunity for being a moderator of this program. And yeah, I am Hosna Maharu Aporna from Saphena Women's Dental College, session 2019 and 20. Now let's introduce our the honorable judges who makes this program more special. Firstly, I will introduce our honorable foreigner teacher, Dr.Subash Raj sir, Associate Professor, Department of Periodontics and Oral Implantology, S.C.B Dental College and Hospital, Cuttack, Bhubaneswar, India. Sir, assalamu alaikum. Sir, we are here. Are you hearing me?
Yeah.
Ji, sir. Our honorable, another wonderful judge, Dr. Mohammad Ahamedul Milon, sir, BDS, DDC, PhD, Perio, Japan, Assistant Professor, Department of Periodontology and Oral Pathology, Bangladesh Dental College, Joint Secretary, BPS. Sir, assalamu alaikum.
Alaikum assalam. Thank you, Aporna.
Thank you, sir. And the last and our super special mentor of Axis Dental School is our Dr. Anupam Podder, sir, Associate Professor and Head, Department of Periodontology and Oral Pathology, Dhaka Dental College. Sir, assalamu alaikum.
Walaikum salam. Thank you, Aporna, for your nice moderating.
Thank you, sir. Let's introduce our competitors for this exciting session. From the team Cementum Group, our first participant is Maisha Shahrizapu from Dhaka Dental College, session 2017 and 18. Our second participant is moontaha Shamsi Apu from Chittagong International Dental College, session 2017 and 18. And our third participant is Sajal Bhaiya from CD Dental College, session 2017 and 18. Assalamu alaikum, all of our participants. And tonight, the topic is necrotizing ulcerative gingivitis. I would like to request our honorable judges to tell some valuable words to us. Firstly, I will request our foreigner judge and special mentor tonight, Dr. Subash Raj sir. Sir, please tell us something about this program.
Yeah, thank you. Thank you so much. It's good to be the judge in this program by Axis Dental School. I hope it will be a good session, and all the judges from different countries are there. So I expect a good presentation from the participants, and hope to hear something new about necrotizing ulcerative gingivitis.
Thank you, sir. Thank you so much for your golden words. Then I will request to our wonderful mentor, Dr. Mohammad Ahamedul Milon, sir, to tell us your opinion, sir. Please.
Thank you so much. Today's moderator, Aporna. Good evening, all of you. Assalamu alaikum. thank you for inviting me and join today's paper presentation program competition as a judge. Thank you all members of the Axis Dental Schools, especially Dr. Farhad and all of you. And I would like to thank Dr. Anupam Podder Dada, advisor, the paper presentation competition committee, which is organized by Axis Dental School. Actually, periodontology is a very special subject, a very special subject in dentistry, which deals with the supporting structure of the teeth. For example, periodontal ligament and cementa. This is the very important. It is also called the foundation of the all clinical subject of the dentistry because it supports the tooth. As it supports the tooth and remain in the socket by attach the periodontal ligament. Without teeth, the other treatment is not possible, like endodontics, orthodontics, prosthodontics. But there is no post-graduation in Bangladesh in this subject, still now. But I hope this subject will open the post-graduation very soon, inshallah. Anyway, today's topic is the NAG, Necrotizing Ulcerative Gingivitis, which is necrotize the gingival tissue and sloughing. It is very painful condition and it is acute. It gives the sloughing of the gingival tissue and fated odor. Patient may complain the pasty-like saliva, fever, insomnia, constipation, and feeling ill. So I think today's topics will give more knowledge to the third year students as well as young dentists. Thank you, Aporna.
Thank you, sir, for your golden words and spacious speech. Now, lastly, I will move on to our most respectful and our adorable teacher, Dr. Anupam Podder, sir, to give us to his special essence.
Thank you, Hosna, Maharu, Aporna. Very good evening. Welcome all of my beloved student participants of today's program and all knowledgeable judge and event management team of Axis Dental School. Now we are in festival mode in online. Our favorite subject, Periodontology, is delighted by our beloved student participants who are attending this paper presentation competition. Our today's group name is Cementum, who are delighted from, according to Dhaka Dental College, Chittagong International Dental College, and City Dental College. Our today's topic is Necrotizing Ulcerative Gingivitis, that is NAG. It is very much important topic in periodontology. Our beloved presenters that are participating today are Maisha saheriz, moontaha, shamsi, and Sajal. All are session 2017 and 2018 of different dental colleges. Hopefully, all of you will done well. Our knowledgeable judges are Dr.Subash Raj, comes from S.C.B Dental College and Hospital, Cuttack, India. He is Associate Professor, Department of Periodontology and Implantology. And Dr. Ahamedul Kabir Milon, he comes from Bangladesh Dental College. He is Assistant Professor, Department of Periodontology and Oral Pathology. And me, Dr. Anupam Podder, Assistant Professor and Head, Department of Periodontology and Oral Pathology, Dhaka Dental College. Best of luck, all of my beloved students, and thank you, Aporna.
So thank you, sir. Thank you so much to all of our judges also. Now I'm gonna move on to the middle portion of this event, and I am briefing the rules and regulations shortly. Every participant has 10 minutes to show their presentation. I will count down the time. After 8 minutes, I will notify them, and they have to finish it within 2 minutes. And last of all, there will be a question answering session within judges and participants. That's it. I would like to tell Maisha Shariz Apu to show your presentation to our judges. Maisha Apu.
Am I audible?
Yes.
Yes, Apu.
I'll be starting my presentation then.
Ji Apu, obviously you can.
Assalamu alaikum everyone. My name is Maisha Sherry's fourth year medical student from Dhaka Dental College, session 2017 and 18. Today, I will be discussing a disease that is related to one of the most deadliest and tragic event of human history. The disease I'm talking about is known as necrotizing ulcerative gingivitis. This disease has also a misnomer, which is also called trench mouth. This was really prevalent in World War I. Now I'll proceed in the main part of the topic. My chosen contents were history of the disease, definition, etiology, clinical features. Necrotizing ulcerative gingivitis. The history of necrotizing ulcerative gingivitis has been observed for centuries. Xenophon observed sore mouth and foul-smelling breath in Greek soldiers in 4th century BC. Hunter describes the clinical features of acute necrotizing ulcerative gingivitis in 1778, differentiating it from scurvy and chronic periodontitis. Jean Hyacinthe Vincent, a French physician working at the Paris Pasteur Institute, describes a fusospiritital infection of the pharynx and palatine tonsil causing ulceromembranous pharyngitis and tonsillitis, which later became known as Vincent angina. Later, in 1904, Vincent described the same pathogen organism in ulceronecrotic gingivitis. The term trench mouth evolved because the disease was observed in frontline soldiers during World War I. Thought to be a result at least partly because of the extremely psychological stress they were exposed to. The same condition was appearing in civilians during period of bombing raids who were away from the front line and who had relatively good diet during the wartime due to rationing. So it is assumed that psychological stress was the significant causative factor. It has also been associated with high tobacco use in the army. Now let's get to the terminology. Necrotizing ulcerative gingivitis is an inflammatory destructive disease of the gingiva. The other terms used to describe this condition are French mouth, which I have previously mentioned, Vincent infection, acute ulceromembranous gingivitis, fusospiritital gingivitis. Now I'll discuss the etiology. An etiology for a disease is really important for its diagnosis. Necrotizing ulcerative gingivitis is caused by a mixed bacterial infection that induce anaerobes such as Provitella intermedia, Fusobacterium, as well as Parochets such as Treponema. Necrotizing ulcerative gingivitis also associated with disease in which immune system is compromised, including HIV/AIDS. It is an opportunistic infection that occurs on background of inferior alveolar systemic host defense. The well-known causative factor for necrotizing ulcerative gingivitis is smoking, physiological stress, malnutrition, and immunosuppression. The clinical feature is evaluated by history of repeated remission and exacerbation, recur in previously treated patient, site, occurs in single groups and is widespread, Tissue destruction is a long-standing disease. Immunocompromised patient, it occurs in immunocompromised patients, and when bone loss occurs, it is known as necrotizing ulcerative periodontitis. Now I'll elaborate the clinical features. Surface of the gingival crater is covered by a gray pseudomembrane necrotic debris. Now I'll magnify it. Here in the picture, we can see a gray pseudomembrane necrotic debris. Then the age of the patient is generally 15 to 35 years. Pain in the interdental ulceration and gingival bleeding are diagnostic trial. Interdental papilla is inflamed, edematous, and hemorrhagic. Also in the picture, we can see the interdental papilla, which is inflamed, edematous, and hemorrhagic. Interdental papilla is the papilla between two tooths. Spontaneous gingival hemorrhage after slight stimulation, fetid odor, and increased salivation progressively destroy the gingiva and periodontal tissue. I will now discuss the oral symptoms in details. Characteristic lesions are punched out, crater-like depression at the crest of the interdental papilla. In the interdental papilla, in the crest, we can see a punched out crater-like depression, subsequently extending to the marginal gingiva and rarely attached gingiva and oral mucosa. The surface of the gingival crater is covered by a gray pseudomembrane slough, demarcated from the remainder of the gingival mucosa by a pronounced linear erythema. Linear erythema is a red line in the gum area joining the tooth and the mucosa. In some instances, the lesions are denuded of the surface pseudomembrane, exposing the gingival margin, which is red, shiny, and hemorrhagic. If we remove this pseudomembrane, then there will be a red, shiny, and hemorrhagic surface. The characteristic lesion may progressively destroy the gingiva and underlying periodontal tissue. Subsequently, the gingival hemorrhage are pronounced bleeding on the slightest stimulation and are additional characteristics. Some other signs are often found in fetid odor and increased salivation. Systemic symptoms are regional lymphadenopathy. That means the site of the inflammation, there will be enlargement of the lymph node. Slight elevation of temperature in severe cases, there seem to be high-grade fever. Leukocytosis, that means increase in leukocyte in the blood. GI disturbance, tachycardia means increased heart rate, and loss of appetite. And it is seen in children because in severe cases, children are seen to lose their appetite to eat. Now, here are some references I have mentioned. Newman and Karanja's Clinical Periodontology 13th edition, Essential of Clinical Periodontology and Periodontics by Shantipriya Reddy, Shaffer's Textbook of Oral Pathology and 7th edition. Now, I'd like to take a minute to thank our honorable judges and my beloved Anupam Podder sir, Dr.Subash Raj sir, Dr. Muhammad Ahamedul Kabir Milon sir, our host for today, Hosna, Maharu, Aporna, and my fellow participants and the audience for listening. And lastly, Axis Dental School for arranging such amazing program. And thank you for your patience, and always remember to keep on smiling. Thank you.
Thank you, Maisha Shahrizapu, for your awesome presentation. Now I'm moving on to the next participants, our Moshat Moontaha Shamsi Apu to start up. Moshat Moontaha Shamsi Apu. Are you hearing me?
Yes, I can.
Yes, Apu, you can start up now.
Yeah. Assalamu alaikum, everyone. I would firstly like to thank everyone involved in the competition and to our respected judges for honoring us with their presence. My name is moontaha Shamsi. I am currently studying at Chittagong International Dental College. My session is 2017-18. Here's my campus. Today we are discussing necrotizing ulcerative gingivitis. After a brilliant presentation by Maisha, I will be discussing the epidemiology, pathogenesis, histopathology, diagnosis, review, and I will show my references. Firstly, we will learn about the epidemiology of the disease. Here we can see necrotizing ulcerative gingivitis occurs mostly in young adults of low socioeconomic status. It occurs in 20s and 30s of age, and it is related with the nutritional status. It onsets after viral infections such as shown here. Among HIV-infected patients, the reports vary between 4.3% to 16%. Usually in children of developing countries under poor health program are predisposed to necrotizing ulcerative gingivitis. Now, pathogenesis. Pathophysiology of this disease is that it is strongly influenced by the capacity of the microorganisms to invade the host tissues. When we isolate the microorganisms from the necrotizing lesions, they do invade the epithelium. Furthermore, they release toxins which enhance their pathogenicity. These endotoxins work directly by toxic effects or indirectly by activating and modifying host response. Necrotizing ulcerative gingivitis is not found in healthy individuals with good immunity. Histopathology. Upon histopathology, we will see that the lesions cross both epithelium and connective tissue. Epithelium is replaced by pseudomembrane, and connective tissue is hyperemic with engorged blood vessels, dense infiltration of inflammatory cells. This zone appears clinically as surface pseudomembrane. Diagnosis. We diagnose it clinically. We can do a bacterial smear if we want to. Now, to summarize what we have learned together, the review of the topics we have discussed now is necrotizing ulcerative gingivitis is an inflammatory destructive disease. Necrotizing ulcerative gingivitis is an inflammatory destructive disease of the gingiva which presents characteristic signs and symptoms. Disease occurs mostly in young adults with low socioeconomic status. Certain microorganisms and predisposing factors responsible for disease. Microscopically, the lesions involve both epithelium and underlying connective tissue. Diagnosis is based on clinical findings. My references are Newman and Carranza's Clinical Periodontology, 13th edition, Newman and Carranza's Clinical Periodontology, third South Asian edition, Cosson's Essential of Oral Pathology and Oral Medicine, 9th edition, Essentials of Clinical Periodontology and Periodontics, 5th edition, by Shantipriya Reddy, and some internet sources, which are Journals of Contemporary Dental Practice, Volume 5, Number 3, August 15, 2004. Thank you. Again, thank you so much for giving us the opportunity to present necrotizing ulcerative gingivitis in Access Dental School.
Thank you, moontaha Shamsi Apu, for your nice presentation. Now, I would like to tell Sajal Bhaiya from City Dental College, you are requested to go forward. Shamsi Apu, will you please stop your screen sharing? Thank you, Apu. Now, Sajal Bhaiya, please, you would like to go forward.
Namaskar, Adab, and good evening to my honorable judges. My presentation mates and others who are watching me right now. Now, I must say my presentation mates did a very nice job on their presentation. Anyways, firstly, I'd like to introduce myself. I am Sajal, studying at City Dental College, session 2007 to 2018. Today's topic, as we all know, is necrotizing ulcerative gingivitis. While preparing my presentation, I have came across very much informative and interesting things about necrotizing ulcerative gingivitis. Further any delay, let's move into my presentation. Here is my content of necrotizing ulcerative gingivitis, differential diagnosis, treatment plan, prognosis, and complication. I'll explain the differential diagnosis of necrotizing ulcerative gingivitis. There's number one, primary herpetic gingivostomatitis. It's an acute herpetic infection of the gum, sometimes can resemble to necrotizing ulcerative gingivitis, and it caused by primary herpes simplex virus. And there's number two, oral thrush or acute pseudomembranous. It's also called oral candidiasis and is caused by Candida albicans. And there's number three, desquamative gingivitis, and it's the erythematous, desquamatus, and ulcerated appearance of the gum. Here we can see in the pictures, erythematous means redness and desquamatus means shedding. Here's redness and shedding of the gingival tissue and ulcerated appearance. And there, number four, congenital syphilis is a chronic disease caused by spirochete, and the symptoms of this disease appears after birth of several weeks and months, and in some cases it takes a year. And there's the other differential diagnosis. There's chronic periodontitis, diphtheric lesion, syphilitic lesion, and agranulocytosis. I'll explain the treatment of necrotizing ulcerative gingivitis. In the first appointment, mild, gentle, and superficial debridement is done under topical anesthesia. We here use a local anesthetics because there's severe pain due to ulceration. And we also give the antibiotics like capsule amoxicillin, 500 milligram, one capsule, 8 hourly, 5 to 7 days, and tablet metronidazole, 400 milligram, one tablet, 3 times for 5 to 7 days. And also advise the patient to maintain oral hygiene, like use of chlorhexidine mouthwash, and also advise the patient to remove the etiological factors like alcohol consumption, excessive smoking, improvement of diet, multivitamin and mineral supplement. And the second appointment is done after 24 to 48 hours of first appointment, and the treatment is under topical anesthesia, subgingival scaling, and supragingival debridement. Here we cannot scaling properly because there's severe pain, and also advise the patient to maintain oral hygiene and use of mouthwash. And the third appointment here, 1 week after second appointment, here we can see again scaling of the supragingiva and subgingiva, and planning the root and polishing for the polishing for the smoothness of the surface. And we also advise the patient to maintain oral hygiene and use of mouthwash. And the fourth appointment here, fourth appointment is done after 1 week of third appointment. Here we check the patient for any clinical evidence, and again advise the patient to maintain oral hygiene. Is the first fifth appointment is after 1 month of the fourth appointment. Here we again check the patient for any clinical evidence, and also check the patient for any remaining periodontal pocket or port gingival architectures. If it's present, then it indicates periodontal surgery, and also advise the patient to maintain oral hygiene. And the final treatment is recall visit or follow-up after 3 months. Now I'll explain the prognosis of necrotizing ulcerative gingivitis. Prognosis is the future of necrotizing ulcerative gingivitis. If necrotizing ulcerative gingivitis is properly treated, then prognosis is good. Ulcer heal within 24 to 48 hours after debridement. And if the necrotizing ulcerative gingivitis is untreated, is further progressed to no more cancromoris, necrotizing ulcerative periodontitis, and their necrotizing stomatitis and other soft tissue involvement, and then goes to fetal or lethal condition. It means life-threatening condition. There, I will explain the complication of necrotizing ulcerative gingivitis. There's number one, noma or cancromoris or gangrenous stomatitis. Noma or cancromoris is a fast-acting gangrene infection that causes destroy of soft tissue and hard tissue of the oral and peroral structure. There's number two, pericoronitis. Pericoronitis is the inflammation and infection of the gingival tissue around the unerupted tooth, like our third molar, it means our wisdom teeth. And that's number three, peritonitis. Peritonitis means inflammation of the peritoneum. Peritoneum is a inner layer of the our abdominal wall, which covering our organ. And the number four, pulmonary infection. Pulmonary infection or lung infection is caused by bacteria, virus, sometimes even a fungi. And the commonest pulmonary infection is pneumonia. It means our inflammation of the lung. The inflammation of the lung. It caused by bacteria and sometimes also a virus like coronavirus. Everyone know about this. And this the brain tissue, brain abscess. Brain abscess is a pus-filled swelling of the brain tissue when a bacteria or fungi enters into the brain tissue, then occur. Here's my reference. Now, I'd like to thank everyone for showing so much patience. I'm truly feeling blessed to be surrounded so many intellectual teachers like Dr. Subash Raj sir, Dr. Anupam Podder sir, and Dr. Ahamedul Kabir Milon sir. And also, I'd like to thank Axis Dental College for organizing this informative event and creating a very nice opportunity for all the students out there. And I'd like to thank all my friends and teachers who are inspiring me so much. Thank you so much. Thank you, everyone.
Thank you, Sajal Bhaiya, for your golden presentation. Hope our judges will appreciate all of those participants' presentation. Now, I am going to start question answering session about this topic to our participants. Now, I am request to Dr. Subash Raj sir to start up. Sir, will you please start up the question answering session, please?
Okay, thank you. I think all presented in a different way. Good to hear from the students. Okay, so I think for last participant, he spoke more about the treatment planning. So my first question will be why there is necrosis of the interdental papilla in this necrotizing ulcerative gingivitis.
Excuse me, Dr. Subash Raj, your volume is so low. Please speak loudly or increase the sound.
My volume is low. Is it audible now?
Yes, sir, it is audible. Sir.
Audible, sir.
Sir, will I be able to say, or any of, is it for someone specific?
No, anyone can answer.
Sir, it is a specific bacteria is involved, Physiobacterium, Treponema, Spirochetes. And sir, it occurs in immunocompromised patient, in HIV/AIDS patient, if there is poor oral hygiene, and if there is stress, malnutrition, ulceration occurs in the gingiva. Necrosis occurs in the gingiva from that.
No, why this particular part? Why you find crater in interdental papilla?
Because sir, food accumulates there in the interdental papilla easily.
Okay. Any other participant?
Sir, it involves the epithelium and connective tissue and releases toxin. and those phenomena cause crater-like lesions.
Okay. The other one, Sajal Kar. Is
Due
there?
to mixed bacteria, sir, there's many type of bacteria. That's
Okay. Okay. Is there any surgical treatment for this necrotizing ulcerative gingivitis? Any periosurgical treatment is required?
Sir, yes, sir. Sometimes presents are when it make a periodontal pocket, then we can indicate periodontal surgery.
No, because in acute necrotizing ulcerative gingivitis or periodontitis, you don't find periodontal pocket.
Sir, surgical treatment is contraindicated because there is severe bleeding already, an ulceration. So it is better to use a conservative measurement or treatment.
No, in follow-up treatment, you don't require any surgical treatment.
Surgical treatment, sir.
When there is crater formation in the interdental papilla,
Yes, yes, sir.
so what will happen in long term? Does the aesthetic gets affected?
It does get affected, sir.
So any treatment is required for this, or
Yes, sir, of course, sir.
So reconstruction surgery we can do also of the gingiva. Flap treatment করতে পারি, sir. Surgery.
okay? Let other judges.
First visit, we cannot go through a periodontal surgery because there's severe pain due to ulceration. But
Yeah, that's what you have presented that. That's what I'm telling in follow-up treatment. Maybe after.
Yes,
When it is healed, sir, we can do surgery. When the prognosis is better, we can do surgery. I think so.
Okay. Anyone can
knowledge.
name anyone surgery?
When the periodontal health is poor, periodontal surgery is indicated sometimes.
What periodontal surgery is very vast. What particularly can you name many surgery?
But
Okay. Let's.
sir,
Yeah.
periodontal flap surgery. Flap
Zygoplasty,
surgery.
No. Just it is. I'll give you hints. Just you have to recontour the gingiva.
Contouring, gingival contouring, sir, করবো. Gingival contouring.
No exact terminology.
Yes.
Gingival contouring করবো, sir. I forgot it. আমি জানতাম, sir.
Okay.
Dr. Subash Raj, sir, please give your answer and put up all the question of all judges. Please put up this, and after ending the session, you discuss about all of.
Okay. Let other judges.
Yeah, move to Hosna, please.
Ji sir. I will move to you, sir. I will move to our Dr. Anupam Podder, sir, to share your point of view.
Thank you, Hosna Aporna. I'm very much grateful to our beloved today's participants. An excellent presentation of all of you. Excellent presentation, very amazing presentation. You are doing best. I think it is the best one. So I have a question to Dr. Maisha. It is basic
sir.
question. It is a basic
Yes.
question to you.
Yes, sir.
What is the normal shape and surface texture of the gingiva?
Sir, shape হচ্ছে স্যার scallop shape,
Surface architecture?
stippled. Stipple থাকে স্যার, stippling থাকে।
Stipple. What are the change occur in the anatomy, in shape and architecture?
Sir, there is bleeding, hemorrhage, and ulceration, sir.
In the shape and architecture, surface texture, change in the shape and surface texture.
The shape becomes rounded or swollen because of the inflammation, and sir, the stippling is absent. And stippling is absent because of the ulceration and the tissue necrosis.
Now I'm going to the Mushrak Muntaha.
Yes, sir.
What are the organism involved for a NAC? What are the organism involved? What are the species of organism? What are the group of organism? Name of the group of the organism?
Sir, sir, bacteria like Fusobacterium, spirochetes, Fusobacterium main.
Aerobic or anaerobic?
Sir,
So may I answer?
Sir, I can answer.
No. Only Mushrak Muntaha.
sir, sir, anaerobic. Sir,
Okay, now I'm going to the Sajal course. What is the oral hygiene instruction of this patient suffering from NAC?
Sir, oral hygiene instruction to avoid, first of all, he has to avoid the hot spicy food. Then also brushing, using that brush which have soft and medium sized bristle, and and interdental cleaning. For interdental cleaning, he has to use he has to use there's periodontal brush, the interdental brush. Then also you have to use that also you have to use this mouthwash like chlorhexidine and povidone iodine tetracycline, and the best and ideal cheap and available mouthwash is cheap salty warm water.
Okay, thank you. Thank you, Hosna, Aporna. You may move to Dr.
Thank you,
Subash
sir.
Raj, sir. Dr. Subash Raj, sir. Please put up the question and answer in ending the session, please.
Okay.
All my question, all your question, all next judge's question.
Okay.
I will request to start a discussion with Dr. Ahamedul Kabir Milon, sir, to start up, sir, please.
Thank you, Aporna. Actually, excellent presentation. I would like to a question to ask the Maisha.
Yes, sir.
Can you hear me?
Yes, sir.
Describe the morphology of ulcer of MR.
Morphology of anak ulcer.
Anak ulcer. You know there are many types of ulcer.
Yes,
The
sir.
anak is the one type of ulcer.
Yes,
So
sir.
what is morphology?
Sir, the surface is swollen because of the inflammation, and it is there is severe bleeding which causes hemorrhage, and there is formation of edema, and there is severe pain.
Actually, the ulcer, the base is what? Base and rope. This is the morphology. Actually, it is the not the morphology, but it's the clinical feature. You
That
know.
is,
Okay, thank you.
yes, sir.
I would like to move to Musrat Muntaha Sasmi. Can you hear me?
Yes, sir. Assalamu alaikum, sir.
Alaikum assalam. What are the complications of anar? What are the complications of anar?
Sir, if necrotizing ulcerative gingivitis is not treated, it causes destruction of the interdental papilla, and sometimes it may extend to the alveolar bone, which causes necrotizing ulcerative periodontitis also.
And others, this is the one complication. The nerve is converted to nerve.
Yes, sir. Sir, destruction of the interdental papilla.
Other complication?
Sir, destruction of the interdental papilla.
I mean,
Sir,
the other complication,
Sir, gum abscess. Sir, gum abscess, and then loosening of teeth from socket.
No loosening of teeth. Actually, others complication was the is noma. You
Yes, sir.
heard the noma?
Yes, sir. Cancromoris.
Cancamoris. Okay. I would like to a question to Sajal Kaur.
Yes, sir.
Do you hear me?
Yes, sir. I'm hearing you.
What types of mouthwash
Yes, sir.
are recommended for the treatment of anal? What types of mouthwash are recommended for the treatment of anal? What types of mouthwash? You know there are many types of mouthwash.
Yes, sir. I suggest to use chlorhexidine, antiseptic mouthwash, sir.
How it will be used? Okay, thank you. ঠিক আছে, you proceed, Aporna. You can proceed.
Yes, sir. Thank you, sir, all of our judges for this question answering session and all of this. So I will move on to our honorable foreigner teacher.
Hosna, please, now you're moving to Dr. Subash Raj, sir, for
Yes, sir.
discussion of today's presentation and today's question answer session.
Ji, sir. Sir, I would like to Subash Raj, sir, to tell something about this.
So, thank you, Aporna. You have been a wonderful moderator since from the beginning, and I will also like to thank Dr. Anupam Podder for taking periodontology at Bangladesh to a good step. So I appreciate his initiation, and he is in constant touch to all the periodontists here in India as well. So I wish him all the best. Let the Perio go to go to a broader shape in Bangladesh. And I would like to thank the other judge, Dr. Kabir, Milon. So we had a wonderful session. All these three students, they have presented well. Sajal Kar mostly focused on treatment part, and other two from for all the etiopathogenesis part and all this. So there are good questions from all the judges, and the participants have tried their best to answer this. So the question that I was putting, I just wanted to listen the word gingivoplasty from the participants, like the recontouring, some like somebody was telling. So
Gingival contouring.
gingival contouring.
Sorry, I said gingivoplasty.
Acha, you told gingivoplasty.
Yes, yes, but,
Okay, so,
but not sure that's word. Okay. Yes, sir.
Okay, good. So it's all, we should appreciate you all that you are presenting in such a nice way. So I hope all the best for all your programs, and it's wonderful to be the part of this Access Dental School program. And thanks to Dr. Anupam Podder for arranging all these programs.
Thank you so much, sir. At the end of this session, we have learned many things, and hopefully we have overcome all types of confusion in this regard. So we are very glad and feeling precious because especially our teachers are giving time here for their busy schedule, especially our foreigner teacher, Dr. Subash Raj sir. Thank you so much, sir, for all of this. And I'm really very glad to talk with you, such a wonderful teachers. Obviously, Dr. Anupam Podder sir, Ahamedul, Milon sir, and Subash Raj sir. And not only me, I hope full of our Exist family are feeling like that. So thanks for giving us time, and especially our foreigner teacher again. We are all of about in the last moment. So our time of the presenter's presentation is Maisha Shariz Apu, 8 minutes 3 seconds, Murshad Muntaha Shamsi Apu, 4 minutes 30 seconds, and Sajal Karbhaya, 88 minutes 10 seconds. I want to announce the name of the participants of episode 10. Mohammad Fayaz Ahmed from Khaja Yunus Ali Medical College, session 2017 and 18. Tashfia Manzoor Chowdhury from Bangladesh Dental College, 2017 and 18. Nafisa Anjum Holly, Sarsorimullah Medical College, Dental Unit, session 2017 and 18. Now I'm seeking permission to conclude this program from our honorable teachers. Sir, if you tell us something about this.
Thank you, Dr. Aporna. You are studying. He's the first year of the BDS student in Saphena Dental College. He's only not one. He's one of the women's dental college in Bangladesh. Another is Kumudini Medical College Dental Unit. Maybe it is our honor. So all the participants of today's session, very much interesting session. It was very much interesting session. It was amazing session, and they collect different parts from books and online on net. It is very. I am appreciating all of you. In future, you do more better, and thank you, Aporna and Dr. Subash Raj sir, for your valuable time with us. I think in future you are always with us. I have organized different types of programs, that is public awareness program, paper presentation competition for the students, and individual periodontal diseases by with Dr. Professor Dr. Anupam Podder sir, me in different episode. this is a single program and multiple public awareness program by the Periodontal Society and also the paper presentation program. And hopefully we are doing another episode after completion this type of episode. We continue the different type of episode in periodontology. We are trying to develop periodontology in Bangladesh. Hopefully we are in a successful condition. In our country there is no post-graduation degree, but our one of the medical universities, Bangabandhu Sheikh Mujibur University, they try to starting MD course as a paraclinical science, paraclinical subject, periodontology, and I hope this is the first time and this start. Then we modified the course. It is going to MS, and but nowadays it is if you want to start the course, the name of MD course would be as a paraclinical subject. But you modify next in MS as a clinical subject. But we try to entry the course, and finally there is another information to us. The Bangladesh College of Physician and Surgeon will start the fellowship program, that is FCBS program in periodontology. They are trying to the surveillance, the feasible study of the subject, and we help them for different type of papers collection, and hopefully they organize a meeting for the all panelists, all faculties of Bangladesh who are teacher of this subject. And I hope we are in the climb up the tree. We are well organized. Bangladesh Periodontology Society well organized, and hopefully we are in the successful condition. Thank you.
Okay, thank you, and I hope you succeed in all what you want. All my best wishes.
Dr. Ahamedul, Kabir, Milon, sir.
Thank you, Aporna. Actually, thank you, our foreign judge, Dr.Subash Raj. Most welcome to join our paper presentation competition. Thank you, three presenters, Maisha, Sharaj, Sajal, and moontaha for your nice presentation. Actually, it is the first time in Bangladesh. So I think you are the first time to present here. So gradually it will be increased. So I think I ask you a little bit difficult question, but don't worry. Just simple things you should to know. Just definition, clinical feature, I mean sign and symptoms, treatment plan for NR. Is it enough for undergraduate student? As it is a competition, just I asked you a little bit difficult question. Don't worry about my question. You should try to learn many more, because the periodontology subject is the very vast subject. Actually, in our country, it is neglected. But if we can start the post-graduation, it will be day by day gradually developed. So all the best. Thank you, Aporna. All the best.
Sir, Kabir, Milon, sir.
Yes.
What is the morphology of the anal ulcer?
Actually, any ulcer can be you know the morphology of the ulcer, the basic morphology, you know.
Yes, sir. Sir, everted, rolled out, sir, beaded. এটা বলতে হতো?
Yes. This is the actually.
ও আচ্ছা, আমি বুঝতে পারিনি স্যার, সরি।
হ্যাঁ, আমরা সাধারণত জেনারেল সার্জারিতে কিন্তু একটা মরফোলজি করে আসি, আলসারের
জি স্যার,
মরফোলজি,
জি স্যার।
আলসার কিনা, এটা বেসটা কোথায় থাকে, এগুলো হলো মরফোলজি। আর তুমি যে আনসারটা করেছো সেটা হলো জাস্ট ক্লিনিক্যাল ফিচার, যে
আচ্ছা,
জিঞ্জিভা
বুঝতে পারিনি,
হয়,
আমি
রেস্ট
বুঝতে
হয়।
পারিনি, সরি।
Don't worry about my question. just that this is the competition, so
Yes, sir.
that's why I asked you a so little bit difficult question. Don't worry about this. Actually your presentation is very nice. You can show the warrior of the army. It's very nice looking.
Thank you,
Very
sir.
nice looking. Thank you. Maisha, don't worry.
So thank you everyone to our teachers and presenters and exist workshop eventing members who arranged the whole presentation and competition of this exist dental school. And this is the first time happening in Bangladesh, I think. So I just wanna ending this program. So assalamu alaikum everyone. Stay safe, stay healthy.